Okay, I want to thank everybody for joining. I'm going to start again. My name is Stacy Villagran. I'm the Senior Director of Health Insurance Programs for the Nassau-Suffolk Hospital Council. And today I'm going to talk about enrollment assistance and Medicaid, which is free assistance for adults and children, disabled or blind, and anyone over the age of 65. And before I start, I just want to thank North Babylon Public Library for giving me the opportunity to speak with you today. So since 2000, Nassau-Suffolk Hospital Council has provided application enrollment assistance for Medicaid free of charge. Currently, we are providing assistance to adults and children who are disabled or blind and anyone over the age of 65 in partnership with Suffolk County Departments of Social Services throughout Nassau and Suffolk counties. Right now, we're providing assistance by phone during the COVID pandemic. So enrollment staff complete and sign the application with your permission and send it to the local departments of social services for processing. Trained staff at Nassau-Suffolk Hospital Council will assist in completing the Access New York application and the Supplemental A. The Access New York application involves information pertaining to household size and monthly income. The Supplemental A requires information pertaining to resources and the type of Medicaid you're looking to apply for, which I will be going over shortly. Right now, during the COVID pandemic, there's minimal documentation requirements to make the processing a little bit easier due to us not having face-to-face visits anymore. But as always, staff communicate with applicants throughout the process, inform them of any additional information needed by the local district, and we continue to advocate, track, and monitor every application sent to the local departments of social services until a determination is made. Medicaid for the Aged, Blind, and Disabled program is processed through the Departments of Social Services as opposed to the online marketplace that some may already be familiar with. These applications are paper applications, and they're also referred to as non-Magi Medicaid. The programs that fall under non-Magi Medicaid are Community Medicaid, which covers doctors, specialists, and prescriptions; long-term care, which includes home care services and brief hospital stays; chronic care, which includes, covers nursing home and other permanent inpatient settings. There's also the Medicaid Excess Income Program, also referred to as the Spend Down Program. There's a Medicaid Buy-In Program for working people with disabilities, and Medicaid for adults and children in need of home and community-based waiver services. Now, the gross income is used for non-Magi to determine eligibility up to 100% of the federal poverty level. Medical premiums are deducted from the income, such as the Medicare Part B and the Part D premiums and private insurance premiums. There's also a resource test. So for 2020, a household size of 1 can make up to $875 per month. The resource level is $15,750. For a family size of 2, that income level goes up to $1,284, and a resource level of $23,100. Community Medicaid coverage covers outpatient primary care, specialty care, and hospital care, inpatient psychiatric care, and substance use disorder rehabilitation with a stay of 29 days or less. Community Medicaid also covers prescription drug benefits, and the resource test just requires an attestation of current resources for Community Medicaid. Long-term care services are all the services I just mentioned in the community coverage, plus adult day health care, limited licensed home care, private duty nursing, hospice in the community, the hospice residence program, assisted living programs, consumer-directed personal assistance programs, personal emergency response services, managed long-term care in the community, and the home and community-based waiver services. The New York State 2020-2021 budget includes a major change in eligibility for long-term care. Tentatively scheduled October 1st, 2020, applications will have a 30-month look back similar to applications for nursing homes. This means if non-exempt transfers are made, the applicant will be subject to a period of ineligibility, also called as the penalty period, based on the amount of the transfer. Now, I will say in my conversations with Department of Social Services, even though it's tentatively scheduled for October 1st, 2020, it does not look like it will be enforced on that exact date. With everything going on at the state level, it looks like this is going to be postponed for a bit, but expect it to happen sometime, in 2021. Chronic care coverage is coverage for long-term care in a facility, such as a nursing home. Medicaid applications for chronic care is completed once the person is placed in a facility and the facility expects that the stay will be longer than 29 days. There is a resource test for chronic care, and that's documentation of resources for the past 60 months, also known as the 5-year look-back period. Medicaid buy-in for working people with disabilities is a program that allows people with disabilities who are working and earning more than the allowable limits for regular Medicaid, which I mentioned before to be 100% of the federal poverty level, to access Medicaid up to 250% of the federal poverty level. This allows working people with disabilities to earn more income without the risk of losing Medicaid coverage. So for this program, the income level in 2020 for a household size of 1 is up to $63,492 for the year. The resource level for 2020 is $20,000. For a household size of 2, that goes up to $85,572 with a resource level of $30,000. Now, the amount your income is over the Medicaid limit is called the excess income or spend down amount. For this program, Medicaid is not active until an individual has satisfied its spend down amount. And there are ways to eliminate the spend down. First is to provide proof of medical bills to the local district that meet or exceed the monthly spend down each month. Pay the monthly spend down each month directly to the local district, or provide proof of medical bills that do not meet the spend down and pay the difference. The other is to set up a pooled income trust. A pooled income trust creates a separate account managed by a charitable care organization. The spend down amount is transferred to that separate account every month, and the individual directs the charitable organization managing the account to pay certain allowable expenses with funds in that account. There are requirements for eligibility to set up a pooled income trust. The first is the individual must be disabled, and this also includes age-related conditions. So funds in the trust can only be used for the benefit of the Medicaid applicant. It can only be used for allowable expenses, and when the Medicaid recipient passes, any remaining funds belong to the charitable care organization. These are the allowable expenses for a pooled income trust. So money can be put aside for clothing and food, living expenses such as rent, mortgage, real estate taxes, utilities, travel expenses such as gas and car payments, entertainment, attorney, accountant, and guardian fees, supplemental home care services, geriatric care services, medical procedures not covered by Medicaid. The whole purpose of a pooled trust is to allow an individual to pay for living expenses and still be eligible for Medicaid benefits. Now, when a person is enrolled in Medicare Part A, which covers hospital care, Part B, which covers doctors, and Part D, which covers prescriptions, or in a Medicare Advantage plan, which is Part C, which has all of the parts included in one. It's and is enrolled in Medicaid, this is what's called being dual eligible. So Medicaid is the payer of last resort, always, and works as a supplementary plan covering the 20% that Medicare does not cover. It also covers the premiums for Part B and for Part A if a person is not eligible for free Part A. When a Medicare beneficiary has Medicaid, they are automatically enrolled in Extra Help, which can pay for a lower or no monthly Part D premium, and may include lowering the costs of prescription drugs. Now, I mentioned the resource levels, the resource limits for Medicaid before, and those resources include checking and savings accounts, IRAs, 401ks, stocks, bonds, mutual funds, cash value of life insurance policies, other real properties such as a second home or a vacation property. Now, if a person is over the resource limit but needs Medicaid for long-term or chronic care services, long-term care in the home or chronic care services in nursing home, we do advise that people speak to an elder care lawyer regarding their asset protection. But if a person is over the resource limit and is not in need of long-term or chronic care services, they can enroll into a Medicare Savings Program that will help them pay for their Medicaid expenses. So the Medicare Savings Program assists individuals and couples pay their Medicare premiums, coinsurance, and deductibles. And there are four Medicare Savings Programs. The first is called the Qualified Medicare Beneficiary, sometimes referred to as QIMBY. The Specified Low Income Medicare Beneficiary, referred to as SLMB. Qualified Individual, which is also referred to as QI, and Qualified Disabled and Working Individuals. Now, for the Qualified Medicare Beneficiary, a single person can earn up to 100% of the federal poverty level, which for a household size of one is $1,061 a month. For a couple, that's $1,430 a month. And it pays for the Medicare Part A and or Part B premiums. You can be eligible for QIMBY only or QIMBY and Medicaid. It also pays for the Medicare Part A and Part B coinsurance and deductibles. Now for the SLMB program, that goes up to 120% of the federal poverty level. A single person can make $1,269 per month, and a couple can make $1,711 per month. And the resource level is none, just like in QIMBY. There is no resource level. So it pays for the Medicare Part B premiums only, and you can be eligible for SLMB only or for SLMB and Medicaid with a spend-in. And the individual must be enrolled in Medicare Part A to be eligible for the program. For qualified individuals, this program goes up to 135% of the federal poverty level. For a single person, that's $1,426 a month. For a couple, $1,923 a month. Again, no resource limit. This program pays for Medicare Part B only, and you cannot be eligible for QI and Medicaid. So an individual must be enrolled in Medicare Part A. Now for qualified disabled and working individuals, this program goes up to 200% of the federal poverty level. A single person can make $2,102 per month. A household of two can make $2,840 per month. This is the only Medicare savings plan that does have a resource limit. And for single individuals, it's $4,000, and for a couple, it's $6,000. Now, this program pays for Medicare Part A premium only. It doesn't pay for Part B. The individual must be a disabled worker under the age of 65 who lost Part A benefits because they returned to work. The income limits are 200% of the federal poverty level, but they include earned income deductions. And it does not include the first $65 of earned work income. And 1/2 of the earned income remaining after subtracting the $65 is also deducted for the gross monthly earned income. So what this really means is that a person, even though it says 200% of the federal poverty level, with these earned income deductions, someone could make over 200% of the federal poverty level, can make more than $2,102 a month for a single individual, or $2,840 for a couple, and still qualify for this program. So it's always important to qualify just to see if you're eligible, because chances are with the deductions you will be. There's also added benefits of qualifying for an MSP. And that's if an individual missed the enrollment deadline for any part of Medicare. Enrollment in a Medicare Savings Program waives that lifetime enrollment penalty and allows enrollment into Part B year-round rather than only during the annual enrollment period. So if there's anybody that you know that didn't enroll for all the parts of Medicaid and have been told that they have a lifetime penalty, it would be good to see if they can apply and qualify for a Medicare Savings Program, because that would eliminate those lifetime enrollment penalties. And in addition to being in an MSP, people can qualify for extra help for Part D to help pay for their prescriptions. So where to apply for non-Magi Medicaid and Medicare Savings Programs? You can work with a certified application enroller from the Nassau-Suffolk Hospital Council's Medicaid Enrollment Assistance Program for the aged, blind, and disabled. During normal business hours, Monday through Friday from 9 a.m. to 5 p.m., you can call 631-435-3000 and ask to be assigned to a Medicaid enroller who will call you to provide assistance by phone. After hours, call 631-656-9783 and press option 2. Leave a message and someone will return your call the next business day. Thank you very much for joining me today. If you have any additional questions or a specific case that you would like to discuss, please call 631-435-3000 and ask for Stacy Villagran, or email me at svillagr@nshc.org, and I will be more than happy to help you explain the process to you and get an enroller assigned to you. Okay, thank you very much for joining me today.